Hello everyone. Welcome to Health for You by UBE Media. My name is Dr. Pranav Kumar. I am an orthopedic surgeon and I mostly do spine surgeries. I've been trained in England for spine surgeries and probably I am the only person in Indore who has been trained by neurosurgeons. Otherwise, normally orthopedicians are trained by the orthopedicians and the neurosurgeons by the neurosurgeons. There are lots of topics where there is lots of confusion as far as spine is concerned. Today, I would be talking about degenerative disc disease. So, you need to understand what a degenerative disc disease is. If you understand degeneration, you most of us have had knee problems or hip problems or spine problems, but we don't understand that our body degenerates as it ages, and beyond certain age it starts degeneration. I've seen people who are young, who are involved in desk jobs, getting back pain as early as 20 years of age, and that's because of the wear and tear in the back, and it's mainly the disc which is wearing and tearing. So what happens is you have the disc which gets dehydrated, so the water content of the disc is decreased. So if you look at a disc, any disc is something like this. So any disc is a shape of a disc. So if you have a disc here, there will be a gel here which is been protected by the covering, which is called as annulus. So you have a nucleus pulposus which is in the center, which is basically like a jelly thing, and then you have the annulus fibrosus which is protecting this. So if you talk about the disc, this is how it looks normally. So if you see, there is a space between the two vertebra, and then you have this disc kind of thing which is called the intervertebral disc. And if you see, behind are the nerve roots. So if anything happens to this, the space between the vertebra will decrease and gradually it will start compressing the nerve roots. So if you see, if you go and see, this is what a completely degenerated disc looks like, and this is what a healthy disc looks like. So if you see, the height is decreased, there is bone formation in the front, there is disc which is coming and pressing on the nerve roots, and the whole shape of the disc is gone for a toss. In between is this stage where you have slight amount of decrease in height, slight amount of pressure, but then it ends up having this. So we need to treat this before we reach this. Talking about symptoms is mainly back pain, and we need to understand that back pain, any spine problem, the pain is of mainly two types. One is the back pain, which is mainly because of the problem with the biomechanics of the spine. If you understand the spine, there are curves in the spine which helps the body to be erect and help us walk. Over a period of time, because of wear and tear, the spine curves and the biomechanics gets altered, and this is the starting point of all the problems, because we don't, and this happens, the reason for this is we are not using our back the way we should be using. There was a study published by Nachmason way back in 1970s where they saw the pressure on the disc when somebody is sitting or somebody is standing. So what they saw is, when a person is lying down, suppose if it is X amount of pressure, it will be 4x when somebody is bending forward and trying to lift a weight. So if you understand, the pressures on the disc is great, and we need to understand that our back has to manage all this pressure. The most important thing which helps the spine is the muscles, and if your muscles of your back are not strong enough, all the pressure will be on your back. The reason this happens is, you have back pain and we don't take care of the back pain, and then the muscles gradually degenerate, and this starts the perpetual cycle of degeneration, ultimately leading to all the problems. Some other problems are like, if there is any injury which has happened and caused damage to the disc. Arthritis can also cause degeneration of the disc and lead to degenerative disc disease. Osteoporosis, because of the weakness of the bones, the vertebra which is around the disc, will also cause the problems later on. obesity, because you are putting so much weight on the disc and you are putting more pressure on the disc if your body weight is too high. Smoking is also seen to increase the degeneration. So if all those smokers, I would request to start quitting that smoking, because you need your back to be better. It's bad for your back also, and we need to understand that. But the biggest problem nowadays is because we are our bread earners. When we are going to earn our bread, and most of us sit for long, arduous hours doing our desk job and working day in and day out. And that's the time we need to understand that this itself can cause degeneration. The problem with this is we can't avoid it. We need to work, we need to do our job. But there are ways to mitigate the effects of it. If you can change the way you are sitting, if you can change the way you are doing your daily activities, it will help you a lot and prevent your disc degeneration, and subsequently prevent your problems later on. Treatment, the most important thing in this to prevent disc degeneration is self-care. How you are sitting, how you are doing, if you are involved in a desk job, if you are bending forward, sitting in the same place for more than half an hour, if you're not moving around too much, the rule of thumb is half an hour at a single place, not more than that. If you can move around after half an hour, that will help the back a lot. Physical exercises, there are the problem with exercises is we don't understand that exercises for back are different. There are certain kind of exercises which help each group of muscles. We need to understand that, and we need to do those for our back. Most of us go to the gym and pull weight and do all those things, but that's not the way we can strengthen your back. The way of strengthening your back, and most of the times, take it from me, they harm your back more than helping your back, because we are not trained to do it, we don't do it properly, and if you don't do it properly, it's going to harm you a lot. I am not against the gym enthusiasts, but anything has to be under limits and anything has to be scientifically based, then only it's going to give you advantages. If you talk about physical therapy, exercises, heat or cold, whatever helps you can be done. There are certain centers like us, we do injections for the back pain, we do injections for relieving the pain of the nerves, we do injections for relieving the pain of the muscles, and then it can help you a lot. But the bottom line is still you need to change the biomechanics of your spine, only then you will get back to your normal things. And of course, if you don't improve with all those conservative treatments, you need to have go and have an operation if need be. Hope you have gained from the videos. For more such educative videos, like, share and subscribe to our channel.